As this is a 2-actor cartoon, I cannot talk to this patient directly, because she cannot speak back. You must speak for her. What is this patient here in the ER for?
She says it is a long story.
I am an ER doctor. I know I have made her wait for 35 minutes just to talk to me, but I am very busy, and I don't have time for a long story. Just tell me her immediate symptoms.
She says that her heart rate is going fast and she feels lousy, and that she wants IV fluids. She would like to avoid having to use ER, but in order to go to the infusion center to get IV fluids, she would first have to wait 2 weeks to see her primary care doctor, and convince her to refer her to a cardiologist that will take her condition seriously, as blood and urine tests, and all heart-related tests, come back normal. The cardiologist would have to give her a standing order for IV fluids. Then she would have to find an infusion center, and see what hours are available. Usually they are only open during weekdays when her husband has to work and she has to drive the kids around with various school schedules. Then she usually needs to schedule an appointment at the infusion center, instead of being able to come in when she knows she needs it. Finally, she says it costs her 5 times as much out of pocket to go to the infusion center than to pay her ER visit copay.
Whoa. I told you I didn't have time for a long story. It does sound like navigating the medical system is very difficult, and I wouldn't wish it on my worst enemy. However, I am an ER doctor, and am only concerned with her immediate symptoms. You only said her heart rate was going a little fast. What are her vitals? Why does she think she needs IV fluids?
I do not know why she thinks she needs IV fluids. She said it always helps when she feels like she feels now.
I am a medical doctor. It is my job to tell a patient what she needs or doesn't. I cannot make decisions based off of how a patient says she feels. I need some medical readings. Please answer my question about her vitals.
Her blood pressure is a little low but within the normal range. Her heart rate is 95 beats per minute.
That does not seem that high. It is a little high for a resting heart rate, but nothing that concerns me. Is she having any other current symptoms?
She says she is in pain all over, but that is normal for her. She says she has fibromyalgia.
Oh, I see. One of those patients. I have seen other fibromyalgia patients here before, and their tests always come back normal. I always wonder if it is just in their heads. In mainstream medical science we prefer to make a diagnosis based on a determinative medical test of some kind. Fibromyalgia patients do not fit the norm. Therefore I do not like dealing with them as much. I do not want to think it is beyond my expertise. If all tests come back normal, I have to start questioning what the patient is reporting, and if there isn't a physiological anomaly I should consider.
She is right here and can hear everything you are saying, and is getting visibly angry that you are not taking her seriously, sir. She says that she does not want to talk about fibromyalgia, and is here for IV fluids to help her POTS.
What in the world is POTS?
I did not know either, until she told me it was postural orthostatic tachycardia syndrome. It means that when she stands up, her autonomic nervous system does not regulate her blood vessels to constrict properly, and in order to keep blood flow and oxygen to her upper body, her heart rate increases dramatically. I had her stand up earlier and her pulse jumped up to 190 beats per minute, and she seemed exhausted and out of breath.
Yes, as I am a medical doctor who can easily understand all 4 medical-sounding words in the POTS acronym, I immediately understood from the name that it meant that she had a syndrome where her autonomic nervous system did not respond correctly to changes in her orthostatic posture, in other words, standing up, and resulted in tachycardia, a fast heart rate. However, I do not know anything more about POTS or how to treat it. Wow. 190 beats per minute, huh? That definitely is really odd for heart rate to increase that drastically without vigorous exercise, and merely by standing up. IV fluids would probably help increase blood volume and make it so her heart doesn't have to work as hard. I say to give her the IV fluids and then tell her to follow up with her cardiologist.
She says thank you. All she really came here for was the IV fluids, as she understands she is not going to solve in the ER, something that is a long-term medical mystery that scores of top doctors have not been able to solve for her. She really just needed the IV fluid so she could feel a little better and have something a little bit closer to a normal life for at least a few days. Usually the IV fluids will bring her heart rate back down around 80 beats per minute even while standing. She says if there was any way to expedite the process next time, it would be very helpful. It does not seem like it should take an hour in the waiting room plus 45 minutes waiting for a doctor just to get a simple bag of IV fluids started. Her husband is contemplating getting certified to give IVs so they can avoid the ER in the future.
Okay, I am very busy. I have to track down the radiology results for the patient in room 13.
Okay, he is gone now. I'll go and get the IV fluids ready. Be back in 20 minutes. Then you can wait 30 minutes for the bag of IV fluids to finish. I'll be back 10 to 20 minutes after that, and then 20 minutes after that the doctor will probably release you to go home. In all, the total time from leaving home to getting back home for this ER visit will be about 3 to 4 hours. Just sit tight and we'll get the IVs going.